Hi, Bill here, and I just met Leo, and we're at a business convention in LA, and Leo is having some difficulties with his knee. So I was going to let Leo explain what's going on in his knee, then I'm going to work on his knee for a little bit, and then we're going to have him give a testimonial and share what we did here today at the convention. So, go ahead, Leo.
Yeah, I'm Leo, and I was just walking. I know I have a lot of mileage on my knees since I'm 49 years old, but I was walking and I felt something. It felt like it popped, but it's been swollen now for about maybe 2 or 3 weeks. I can still walk on it, but sitting down and getting up, I don't have the range of motion. As I bend down, I can feel it constrict, so don't have full flexibility and motion in it. So hopefully Bill will be able to help me out, and I'll be able to walk and run and jump again.
Okay, now what I'm going to check with you is how the tension is holding in your knee, which direction feels more comfortable than the other. So I'm going to get a hold of your leg, and I'm going to rotate it in. You feel how it gets tighter in there? It's kind of tight going that way. And as I go out, you see how it keeps going? It's easier, yeah. It's easier when the leg rotates out. So what I'm going to do is I'm going to hang out in that place. Remember I was telling you before about the nervous system needs to recognize that there's comfort going on. So I'm rotating the leg out, and we're hanging out in this position. And I'm waiting for a shift to take place, something different to take place in the nervous system as a result of positioning the leg like this, rotating it out. And can you feel how the bone in the leg is rotating back? What does that feel?
Bill, can you just do the last 30 seconds again, because it's hard to hear what you're doing.
Pain.
Okay,
Where the swelling is.
Something's going on there? Okay. Now, I'm going to go back and recheck. Can you feel how there's more movement in that direction? Inward? You feel how there's more balance as I'm going back and forth. It's not, yeah, it's not so tight rotating in. Okay. So, we got a change to take place as a result of taking your leg to comfort. Make sense?
Yeah.
Okay. So you're saying you had the pain right in here?
It's right across like the line over here.
Okay.
Straight across.
Okay.
I notice it's swelling mostly on the right hand side.
Got it. Now just leave the leg down. Now what I'm going to do is I'm going to push the bone in your leg back and forward. And we're going to get, once again, we're going to create that contrast between where it is right now and find out where it's comfortable. So as I push the leg back, the bone back in your lower leg, you notice how it really doesn't do a whole lot. It's pretty tight in there. And if I push it forward, there's more give. Can you feel that? Okay. So we're going to hang out in the same position, which is the ease of movement. We're exaggerating the pattern that's going on in the leg. And we'll hang out here until, once again, the nervous system recognizes that change. Can you feel how in back of your knee it's kind of fluttering a little bit?
Yeah.
Okay. When you feel that fluttering, that's the nervous system recognizing the fact that it's comfortable. This is the tension pattern that the knee is holding on, creating the pain. It was functional for when you injured it, when it got tweaked. It's not functional for you to walk in your life without the discomfort. So, with that fluttering, there's a recognition in the nervous system that a change is taking place. So we're going to go back and push backwards, and you see how it's springier? So how does that feel across there now? What does that feel like?
Less tension. It doesn't feel
As
doesn't have
tight.
tension. Yeah.
Cool. Okay. Now what does it feel like?
Are you kidding me?
Well, going down my leg, I notice a difference. Like, I don't know if I can kick better now or not. But
Don't
I
kick
feel,
me yet.
Yeah, I wouldn't kick. I definitely feel, yeah, it feels,
Is there anything as I push in here? Is
yeah,
there
I feel something right here with that top finger. There's some,
right in there?
yeah, like the bone.
Okay. So what I'm going to do is that same. We're going to have to play with this here a little bit because I don't have. Normally this takes place on a massage table. So I'm going to lift your leg up, and I'll support it with my thigh here, and then we'll push on the inside here. Does that take the pressure off of that spot? So what happens is the cartilage gets tweaked between the knees, between the bones in the leg. Can you feel how it's warming up in there a little bit?
Yeah.
When you feel the warmth, that's like unkinking the garden hose when it gets tightened. So we're creating space for the blood and the oxygen to get in there. Feel how that twitch went in there a little bit? Maybe not. So we're going to put the leg back down and then recheck. How's that feeling there
I
now?
don't feel that same pain.
Feel different? Did it move?
I don't know if it moved, but at the same point where you pressed before and it hurt, when you just pressed that point, it didn't feel that same pain.
Cool. Okay. So what does the knee feel like now?
I don't know how to describe it, unless I feel like if I walk on it. But
Do you wanna give it a try?
Awesome. It's a pleasure. And all right,
Good stuff.
yeah,
Every hole has to have one.
definitely. Yeah, I feel a difference. That's impressive. I might have hyperextended it because it feels
Right.
like, you know.
When you hyperextend the knee, the body's nervous system reacts to protect it from being torn or broken or something. Okay? So you step funny, the nervous system reacts to it. Spasms to protect the body, the knee, from getting injured further. It's functional for that injury. It's not functional for you to walk around
Right.
without the discomfort.
Pain, but I definitely feel. Yeah, I feel it. That's cool. Worth the $3,000 I paid for this Guerrilla Business School.
Did you not see
That's good. I feel it. Yeah, it's cool.
Cool, Leo. Thank you. Thank you very much.
Great work. Few minutes. I feel. I'm not going to try to run on it yet, but I feel more confident about it. Feels good. Doesn't feel the same pain and
14 minutes countdown.
feels good. That's my testimony.